everyone. Kshowers here. Welcome to episode 2 of Health Horizons, where we explore public wellness. I'm the Prevention and Wellness Coordinator for the city's Health and Human Services Department. I have a master's degree in public health from BU, and I'm a certified health education specialist. Though I've been in the field for over 18 years, rest assured, I'm young at heart. I'm joined today by Ann Whiting. Ann's from Grassroots for Gun Violence Prevention, which is an all-volunteer group that works to free communities from gun violence. Ann lives here in Melrose with her husband and her 2 children. Thank you so much for joining us.
Thank you for having me.
Gun violence has definitely been in the news, and I know on a lot of our minds. The U.S. Surgeon General recently declared gun violence to be a national public health crisis. According to public health research, neither take away all guns or give everyone a gun approaches will work. We can all agree, though, that no one wants firearm injuries in our community and to our loved ones. Today, we'll talk about what we can all do to prevent this public health problem. I want to just set the stage a bit for our listeners today before I turn the mic over to Ann. Recently, the Moving Medicine Apple podcast interviewed Dr. Megan Rainey, who has an MD, medical doctor, and also has a master's in public health. She explained that there were 3 sort of root causes of firearm injury and deaths. They included 1, access to a gun, 2, isolation of an individual, and 3, really the lack of enough data and research on this topic. Dr. Rainey also suggests that public health professionals can develop interventions on lots of different levels, such as making safe gun storage a community norm and connecting kids with other kids by enrolling them in all sorts of programs that we have here in the city through the rec department, through the YMCA, through Boys and Girls Clubs, and there's a lot of amazing organizations here. These are full spectrum public health approaches that are proven to work. I just want to touch further for one more second on proven evidence-based health strategies. I'll use improving motor vehicle safety as an example. So when we're thinking about improving motor vehicle safety in the environment we're in, it's going to include, and does include now, requiring safety features for our drivers. So, for example, seatbelts, right? It includes adding safety features to the cars themselves. So airbags is an example of that. And finally, creating safer road environments. So when we're designing roads, we're thinking about divided highways and making those. And we're thinking about having safe speed limits for various roads and roadways. So that type of science we can apply to gun violence prevention. So Ann, I'm going to turn it over to you, and we're excited to hear from you to discuss various things on this topic, but specifically secure gun storage and how that is a key public health measure that's going to prevent gun violence.
Great. Thank you so much, Kara. So we know that easy access to guns is life-threatening to children, teens, vulnerable adults, and secure firearm storage is one evidence-based solution to prevent specifically unintentional shootings and suicides. Whether we are gun owners or not, we can all use the principles of secure gun storage to keep our families and communities safe. First, unintentional shootings. What does that even mean? Unintentional gun injuries or deaths can occur when someone handles and accidentally fires an accessible, unsecured gun. And children and teens are particularly impacted by unintentional shootings because it can be so easy for them to gain access to an unsecured gun in their home. Last year, there were over 400 unintentional shootings by minors across the U.S., resulting in over 150 deaths. So these injuries and deaths are preventable just by storing firearms securely. Secure firearm storage is also a measure we can use to prevent suicides. And I'm glad we're talking about this now in September, which is National Suicide Prevention Month. Over half of all firearm deaths are due to suicide. It doesn't get a lot of attention. We think of homicides, mass shootings, school shootings, but it's really suicide that makes up over half of all firearm deaths. So we must consider suicide when talking about reducing gun violence. And 2 points are important here. Number one, firearms are the most lethal form of suicide. Nearly 90% of suicide attempts using a gun result in death. 90%. And number two, the majority of people who die by gun suicide used a gun that was accessible to them from their own home or that of a family member. So we can save lives simply by ensuring that guns in the home are stored securely. A gun that is not easily accessible puts time and space between someone who is in a moment of crisis and a lethal means of suicide. I also want to mention red flag laws here just briefly, which is another important way to reduce suicide by firearms. Massachusetts has a strong red flag law, although it is underutilized. In Massachusetts, family, household members, law enforcement, and newly school administrators and licensed healthcare professionals can petition a court to issue an extreme risk protection order, or ERPO, ERPO, which orders the temporary removal of firearms from a person who presents a danger to themselves or others. There is due process built into the law, and this is another way to ensure that in a moment of crisis, a person does not have access to a deadly weapon. So what can we all do to practice secure firearm storage? All of us, whether we're gun owners or not, what can we all do to reduce unintentional shootings and gun-related suicides? First, secure guns in the home. This means firearms should be stored locked and unloaded with the ammunition locked separately. Hiding a gun is not securing a gun. This is the recommendation of the American Academy of Pediatrics, the American Public Health Association, the National Shooting Sports Foundation, and many other organizations. Also, we should all educate ourselves on Massachusetts regulations. Massachusetts has a safe storage law in place. By law, when firearms are not under the direct control of a lawfully authorized user, firearms must be locked when in the home and must be unloaded and locked, with some exceptions depending on the type of firearm, when in a vehicle. Furthermore, there is also a child access component to Massachusetts safe storage law. The law imposes criminal liability on someone who stores firearms where a minor without a valid FID card may gain access to them. Next, we should all talk to our children in an age-appropriate way about safety around guns, regardless of whether or not you own guns. We should ask about the presence of unsecured guns in others' homes, especially if we have children visiting. Parents already ask about so many other safety topics when planning a visit for their child: pets, food allergies, alcohol, presence of adults, pools on the property, car seats, screen time. So many safety topics. We should include gun safety in this conversation and normalize the conversation around gun safety. It's not about being confrontational or judgmental. We're not asking about if there are guns in the home, but rather how they are stored. Remember, the bottom line, safest answer is yes, and our guns are unloaded and locked, and ammunition is locked separately. I'll acknowledge this can feel awkward asking about firearms in others' homes, which is why it is so important to normalize this conversation along with other safety topics. And I think most people would agree that they would rather ask the question than not know at all. And then finally, to learn more about gun violence prevention, you can visit our website, Grassroots for the number 4, GVP.org. Grassroots for GVP.org.
Great, Anne. Thank you so much. That was a great overview of how we can start conversations and why securing guns is so important. So I really appreciate you joining us and very much appreciate MMTV as well, since they pull all of this conversation together and tie it up with a bow. So thank you so much. And until next time, take care.
Thanks, Kara.